Hello, my name is Kyle Versteg. I'm a plastic and reconstructive surgeon and I live in Traverse City, Michigan. I started the practice Grand Traverse Plastic Surgery opening June 1st, 2017. So if you're seeing this video, we're probably already open and have been for some time. Anyway, rather than make a video in an office today, I decided to go outside because it's so nice. It's spring in Traverse City. And so you're probably going to hear some birds and wind chimes and some other noises. Don't worry about that. What I wanted to tell you about today is what is plastic surgery. And if you watch TV, if you go online, if you follow newspapers and things, probably the first thing that comes to mind is something you've seen on TV where the surgeon has a big, huge personality and does a lot of cosmetic surgery and a big, expensive lifestyle and things like that. And that certainly exists, but that is not all of what plastic surgery is. Just to tell you a little bit about the history of plastic surgery, the first earliest mentions of plastic surgery are actually from 3000 BC, from Egypt. And some of the earliest things that we have are on papyrus scrolls, and it describes rhinoplasty or nose surgery. And then you go 800 BC in India, and you can see rhinoplasty discussed there as well as other things. And then continuing on into the modern times in America, plastic surgery really got big boosts whenever there were wars. So for instance, after World War I and especially after World War II, every time you have a lot of injuries, there's a lot of unfortunate people who you can help, and figuring out ways to help them is one of the main focuses of our specialty. So with that, there are lots of different things that plastic surgeons do. One is cosmetic surgery, and I don't have to tell you about that because you know what that is. Another thing is burn care. So if you're burned and you have severe burn injuries, the chances are at some point you're going to meet a plastic surgeon. Now, I trained in burn surgery at a couple different places. One is at the University of Kansas in Kansas City, Kansas, and the other is at the University of Louisville. And while I was at the University of Louisville, I worked with Dr. Hiram Polk and Dr. Gordon Tobin. And they are two people that really modernized the way that burn surgery is done, emphasizing things like early excision of the burns and grafting. And that really that combined with a lot of other things that we've learned since then has reduced the mortality rate of severe burns. Another branch of plastic surgery is just plain old reconstructive surgery. So you have an injury. Let's say you injure your face and you have some broken bones in your face. The chances are you're going to either meet an ENT surgeon. They do some of that. You might meet an oral surgeon, oral maxillofacial surgeon, and they may fix your mandible, and some of them will even fix bones in the face. And you may meet a plastic surgeon because we do a lot of that. Also, people get injured in a lot other ways, and I don't have to describe to you some of the horrible things that happen to people, but a lot of times plastic surgeons end up involved in trying to restore form and function in those situations. We also do reconstructions after cancer surgery. So if you've had breast cancer or know someone who does, they know a plastic surgeon. We also treat skin cancer. So if you have say a melanoma, a lot of plastic surgeons will excise the melanoma and do things like sentinel lymph node biopsy to see if the melanoma has gotten out of that particular location. And then we do reconstructions for those things. One of the big parts of my practice is reconstructing after Mohs surgery. So if you've had a basal cell carcinoma or a squamous cell carcinoma somewhere on your face, you may have had what's called a Mohs surgery, where a dermatologist goes in and excises the cancer and looks at it layer by layer until they're sure that they got it all. And then if they can close it themselves, great. If not, a lot of those patients get sent to plastic surgeons, and that's a major component of my practice. Then there's things like wounds. we do tons and tons and tons of wound care. If somebody bangs their shin and has a big wound on their shin, we help them get through that. People who've been in accidents or have had other reasons why they might become paraplegic or quadriplegic will sometimes develop pressure sores, and we help with that. Another thing we do, because we do all of these other things, is hand surgery. I don't do a lot of hand surgery myself, although some plastic surgeons do, and 25% of our board certification test covers hand surgery. Mainly in the hand, I deal with reconstructing soft tissue of the hand. I really don't do a lot of bony work, and I really don't do a lot of tendon work, but there are plastic surgeons who do. A lot of plastic surgeons deal with congenital deformities, especially congenital deformities of the face and of the skull. You've probably heard of cleft lip and palate surgery. That's one of the main things that plastic surgeons do, and every plastic surgeon has training in that and is capable of doing it. I don't do a lot of cleft lip and palate surgery because I think that those patients need to be taken care of in a specialized center, and I've never really been associated with a specialized center for that. But there are plastic surgeons who do that. Another area of plastic surgery involves microsurgery. And in that, we can take skin, muscle, and even bone from one part of the body and move it to another part of the body and use a microscope to connect the vessels so that everything stays alive. Sometimes, especially on the lower part of your leg or in other parts of the body, there just isn't enough local tissue to reconstruct things. Or in the case of the jaw, there's not enough bone, and so you have to take bone and skin and other tissues and put it in there to help reconstruct that so that somebody can get dental implants. We also use microsurgery to recreate breasts. A very popular procedure that I have done and I still do occasionally is called a DIEP flap, D-I-E-P. And what that does is take skin and fat from your abdomen and connect it microsurgically up to your chest so that we can rebuild a breast. And finally, one of the big parts of my practice is just oddball stuff. Somebody has something, they don't know what to do with it, and they'll call you because they know it doesn't fit into any particular surgeon's practice. That's a blue jay, by the way. He's being pretty naughty, interrupting our video. They know that they've got a problem that doesn't really perfectly fit into anyone else's practice, and they'll call you and see if you can help them out. And that's a big chunk of what I do, is kind of troubleshooting problems that really don't fit super well into a lot of other practices, but they need somebody to do something for them surgically. Now, all that being said, every plastic surgeon probably does some cosmetic surgery, and I do. I do just about everything you can think of. I don't do a lot of rhinoplasty, but everything else, if you've heard of a cosmetic surgery, the chances are I've done that and still practice that on a daily basis. And that describes probably most plastic surgeons. We all have things that we like more than others, and we all kind of tailor our practices around what it is we like to do. My particular practice, I operate from the top of the head to the tip of the toes. Literally, I've done reconstructions on the top of somebody's head and literally worked on people's toes before. So, that's plastic surgery in a nutshell. Thanks for watching. I wish I could tell you more. You could literally read books on the subjects. This is just a brief overview for you.